Namaste, welcome back to my channel. Today I'm going to explain you about nursing MCQ, which is very helpful for all nursing staff. So in that, question number 1. Atherosclerosis impedes coronary blood flow by which of the following mechanism? The options are A. Plaques obstruct the vein, plaques obstruct the artery. C. Blood clot from outside the vessel wall. D. Hardened vessel dilate to allow blood to flow through. The correct answer is B. Plaques obstruct the artery. So when plaque obstruct the artery, patient will have a reduced coronary blood flow. Question number 2. A client has developed atrial fibrillation which has a ventricular rate of 150 beats per minute. A nurse assess the client for A. Hypotension and dizziness, B. Nausea and vomiting, C. Hypertension and headache, D. Flat neck veins. The correct answer is A. Hypotension and dizziness. So when patient develop atrial fibrillation, first and foremost signs and symptoms is hypotension and dizziness. Question number 3. While caring for a client who has sustained an MI, the nurse notes 8 PVCs in 1 minute on the cardiac monitor. The client is receiving an IV infusion of 5% dextrose and oxygen at 2 liters per minute. The nurse's first course of action should be A. Increase the IV infusion rate. B. Notify the physician promptly. C. Increase the oxygen concentration. D. Administer a prescribed analgesic. The correct answer is B. So, then and there, the nurse should notify to the physician promptly. A nurse notice frequent artifact on ECG monitor for a client whose leads are connected by cable to a console at the bedside. The nurse examines the client to determine the cause. Which of the following items is unlikely to be responsible for the artifact? Options are A. Frequent movement of the client, B. Tightly secured cable connections, C. Leads applied over hairy areas, D. Leads applied to the limbs. The correct answer is tightly secured cable connections. So due to this, patient is getting a artifact. After cardiac surgery, a client blood pressure measures 126 by 80. The nurse determines that the mean arterial pressure map is which of the following? Options are 46 mm of Hg, 80 mm of Hg, 95 mm of Hg, 90 mm of Hg. Correct answer is C, 95 mm of Hg. Next question is, a paradoxical pulse occurs in a client who had a coronary artery bypass graft CABG surgery 2 days ago. Which of the following surgical complications should the nurse suspect? Options are left-sided heart failure, aortic regurgitation, complete heart block, pericardial tamponade. The correct answer is D, pericardial tamponade. Next question is, when ventricular fibrillation occurs in a CCU, the first person reaching the client should administer oxygen, defibrillate the client, initiate CPR, administer sodium bicarbonate. The correct answer is defibrillate the client. So only defibrillation will be helpful to stop the ventricular fibrillation. Next question is, a client with rapid heart rate like atrial fibrillation Ask a nurse why the physician is going to perform carotid massage. The nurse responds that this procedure may stimulate the vagus nerve to slow the heart rate, vagus nerve to increase the heart rate, overriding the rhythm, diaphragmatic nerve to slow the heart rate, diaphragmatic nerve to override the rhythm. The correct answer is vagus nerve to slow the heart rate. The next question is a client is having frequent premature ventricular contraction. A nurse would place a priority on the assessment of which of the following item. Options are blood pressure and peripheral perfusion, sensation of palpitations, causative factors such as caffeine, precipitating factors such as infection. The correct answer is A. Blood pressure and peripheral perfusion. The next question is a nurse is viewing the cardiac monitor in a client's room and note that the client has just gone into ventricular tachycardia. The client is awake and alert and has a good skin color. The nurse would prepare to do which of the following? The options are immediately defibrillate, prepare for pacemaker insertion, administer amiodarone like calodron intravenously, and administer epinephrine adrenaline intravenously. Correct answer is C. Administer amiodarone like calodron. This MCQ will be continued in next episode. Thank you so much.